Our guest now, Representative Anthony Weiner, Democrat from New York, member of the Health Subcommittee of Energy and Commerce. And we're told you come to the table with some new health care information that your office compiled. What do you have to tell us?
Well, it's more kind of another way of looking at this debate and discussion about the public option, to put it in focus. We went just out of curiosity and looked how many members of Congress get the public option. And I know a lot of people have said, well, under the new bill, how many of you members of Congress would choose the public option? Well, there already is one. It's called Medicare. And we found that 55 Republicans and 151 members of Congress are on Medicare right now. So they're already getting the same type of public option that we'd like people who are without insurance to be able to get. And I guess the purpose of this list was to kind of point out some of the hypocrisy of this debate. You have members of Congress thumping their chest how they're against government health care, against government-controlled health care and socialized medicine, and yet when it's time for them to accept Medicare, they're like, sign me up. And part of what I've argued in arguing for a single-payer system is that, well, we have Medicare for those that are 65. Why not 64? Why not 20? Like you're about 24, I'm sure.
Sure.
And why not have that type of a system that has lower overhead, lower costs, and you don't have to deal with the 30% of profits and overhead that insurance companies take. So we compiled this list largely to point a bright light on some of the hypocrisy of this debate, but also I hope it gets people thinking, if Medicare is good enough for 151 members of Congress, why shouldn't a program like it be created for those who want to go out and buy insurance?
So on this idea of a public option, last we've heard there were 3 different versions floating around on the House side of the Hill. Can you talk briefly about the differences between them and which one is your favorite one?
Well, let me make it very clear to begin with, Paul, that I believe that the public option is only a sliver of competition. That really what I would like to see, and there's going to be an amendment on the floor that I'm going to be offering, which would have a program like Medicare for all Americans, essentially single-payer system like Medicare and Medicaid, but for all Americans. But that is not probably going to pass. What is going to be included is this notion, if you have your own insurance, you're not going to be able to sign up for the public option. But if you're looking for insurance, it's going to be one of the choices that you have. And so how are they going to structure it? Well, the fundamental question that we're trying to answer is when you have this government administered program, how are you going to set the rates that doctors are going to get? And the baseline is Medicare. Medicare rates are pretty low for doctors. They get high efficiency and easy service, but the rates are pretty low. So one proposal would say Medicare rates plus 5%. If it's a $10 procedure, it'll be Medicare plus 5%. One proposal says you just let the marketplace decide what the rates will be. And the problem with that is that becomes more expensive because the rates will probably float higher because they'll get up to about where insurance rates are. And then there are other proposals that would essentially say, you know what, let's have some type of a trigger of some sort, either an opting in or an opting out at the beginning of the process. My view is it has to be linked to Medicare in some way, or else you don't get the cost containment. There has to be something tethering rates down, and so Medicare plus 5% is considered the vigorous option that I think we're going to pass in the House.
Of course, one way to look at the story is through the numbers, and the big number 0 is out there. No Republican votes from what we've been reading. Do you think that will be the case, and does that matter to you?
Well, it matters in the abstract sense that it's regrettable that fully half the country who are they're a little less than half the country who send their members of Congress here have essentially said, on behalf of their constituents, I'm no on anything. And that's regrettable. And however, at the end of the day, look, this is the Democratic-controlled House, Senate, and presidency. We were elected to do this. When Democrats passed Social Security, we had no Republican help. When Democrats passed Medicare, there was very little Republican help. When we've tried to improve the quality of health care in general, we usually got pushback, and usually the Republican ethos has been, let's give more money to the insurance companies and let them work it out. So I'm not terribly surprised, but I am disappointed.
So on your side, the magic number is 218, and we've been hearing all week about this whip count that's been going on, maybe since Monday or Tuesday. There's this headline before we get to calls in the Hill. Centrists versus Pelosi. They write that the Speaker's decision to tack left in the health care debate has prompted complaints from centrists and started high-stakes vote-counting operation. One point they're making is the Blue Dogs, those 50-plus conservative Democrats, at least fiscally, might be a major problem. What do you think?
Well, I believe that the centrist, fiscally conservative position here is the public option. CBO says it's the way that you reduce cost. Competition choice, the free market, has always been kind of a centrist blue dog philosophy here. So I think this is I think the way the battle lines have been drawn are a little bit inaccurate, that in fact, I think most people who want to contain costs want the public option.
Let's go to calls now for Congressman Anthony Weiner, Democrat from New York. It's Brooklyn and some other sections.
It's mostly Queens, actually. It used to be 100% Brooklyn. Then as redistricting and as the growth of Queens is actually growing faster than Brooklyn, so now I have a district that's 75%, 70% Queens, 30% Brooklyn.
Let's hear from Eagle River, Wisconsin first. Ron, you're on the line for Democrats. Good morning.
Yes, good morning. I'm in a situation where I've got a health problem, a heart attack a little over a year ago, and I'm still too young to get on Medicare, okay? And I'm sure there's just literally millions of people in the same situation, and I can't understand why the people in Washington just can't figure this out, just lower the age, and allow people from 50 to 55 to buy into Medicare. That's when our bodies are falling apart, sir. And it would be so easy to do this. So, and another reason, and I'd like to address this to the Republicans, if they keep saying our system is the best, in the world, well then why are we the only people in the world to have a system that treats health care as a commodity?
Congressman.
Well, Ron's exactly right, and my fiance's mother asks the same question all the time. Look, Ron's exactly right. What's magical about 65 as the cutoff date for Medicare? Why not 64? Why not 54? Why not 34? The fact of the matter is we've had two competing systems going on at the same time. One for the last 44 years has been this Medicare system that people love. On the other side, it's been health insurance policies that people complain about and that take 30% for profits and overhead. So Ron makes exactly the right point. You should run for Congress. It's exactly right that the more people understand that the public option is kind of like a little sliver like Medicare for everyone else. And here I'm putting out a study today, 151 members of Congress apparently love Medicare, and yet they don't want to extend that to others.
Detroit, Mark, you're on the Republican line for Congressman Weiner. Good morning.
Good morning. I'd like to congratulate Congressman Weiner for starting to call out some of the hypocrisy on the Republicans. Even though I am a Republican, I find it just appalling that these guys will say that they want to have open markets and let the market decide what the pricing is, but then they won't allow this public option to happen. And I think we have to call more of these guys out on this approach that they're taking. I don't know if it's just because they're in the pocket of the health insurance companies or what, but that's all I'd like to say.
Let's hear from our guest.
Well, look, you're exactly right. The fact of the matter is if you want choice and you want competition, which will bring down costs through a market mechanism, then you want the public option. The Republican Party is a wholly owned subsidiary of the insurance industry. And that's the bottom line. They have not tacted all away from what the insurance industries want them to do in this debate. And that's regrettable. And I don't think the insurance industry, I don't think they're venal people. They're doing what they're supposed to do in a large respect. They're supposed to take in as much money as they can and pay out as little as they can for benefits. That's what their shareholders demand. That's what the marketplace wants. Unfortunately, members of Congress shouldn't be standing up for that business. They should be standing up for the taxpayers and for patients.
Some of the news write-ups, Congressman, about yesterday's vote in the Senate. They're calling it a proxy vote for the larger health care bill. It had to do with the Medicare physician reimbursements. Reid and Pelosi get a dose of tough medicine is the headline. They say that the public option, yes or no, has been at the heart of debate all year, but Pelosi and Reid were reminded Wednesday the obstacles to getting a bill done are even bigger. In the Senate, Reid got a taste of just how hard it will be to corral his famously fractious caucus. Dozen Democrats joined Republicans to vote down the so-called doc fix to Medicare physician reimbursements because it would add $247 billion to the deficit. Is it a proxy vote? Do you see one connected to the other?
Well, I'll tell you what's interesting is that when some of us argue, let's have the public option tied to Medicare, my Republican friends say, oh no, the Medicare rates are too low. So here it is, we're trying to raise the Medicare rates to give doctors a break and so that they can stay in the Medicare program. And the Republicans say no to that too.